So we've added this patient engagement track for the summit this year. Programs like Meaningful Use and Patient-Centered Medical Home require a patient engagement component. But as you will hear from our speakers today, this requirement should not be viewed as a burden by healthcare organizations, as something that they need to do. But patients are craving this type of interaction to improve the care that they receive. Our session today features 3 speakers. We will hear from 2 patients who will provide their perspective on the challenges in tracking their own health data, as well as making sure their caregivers are well informed, and from a nationally recognized expert and author on patient engagement. First, I would like to introduce retired Air Force Colonel Dennis Redding. He's going to share his story about navigating through a complicated medical diagnosis of 2 separate types of cancer, and what he needs to do to ensure his healthcare providers are informed about all the care he receives. Welcome, Dennis.
Well, thank you. And first of all, I'd like to thank VITL for incorporating this particular session in a process, thank you, that I'm sure is in terms of implementing and integrating medical informatics across the state is a formidable task. But the end result really is at our level, and that's at the patient level. Because ultimately, what you want is the best outcome for the patient and their families. And I thank you, VITL, for including patients as part of this process. Kathy has already introduced me. Let me give you some background. First of all, I was in the military for 28 years. I was in the Air Force. When I was in the Air Force, my medical records consisted of a folder that I hand carried from base to base. Every time I had a change of station, I went to the hospital, picked up my folder, and when I was a young lieutenant, that folder was about that thick. When I finally retired from the military, my folder was about that thick. And that was my medical records. Everything that happened to me from a medical perspective, whether it be at another location, in another hospital, I had a back operation, that was all incorporated into those medical records. I retired, and it says so right here on my badge, I'm retired. I now am faced with multiple doctors at multiple locations. I'm faced with providers who may or may not have the capability to interface with one another. And I'll give you some examples. In 2003, I was diagnosed with stage 3B melanoma. It had spread into my lymph nodes. And in checking to find out whether that melanoma had spread anywhere else, they found out that completely independent of the melanoma, I had kidney cancer. So they ended up performing a single operation, which basically cut the side of my head open, and they finished that, sewed me up, and took out my kidney as well. The doctors for that were at the same location. They were at Beth Israel in Deaconess Hospital in Boston. Needless to say, I had frequent follow-ups. I was on called interferon for a year. I don't recommend that. Well, I do recommend it because I'm fine now. But that year was tough. But anyway, as you can see, I had 2 specialists at Beth Israel. Kidney specialist, oncologist, and the melanoma specialist. I kind of was in control of that. I was going up back and forth to Beth Israel. But I also lived on Cape Cod, and I had some other issues that were going on as well. I started to see a dermatologist on a regular basis, which I hadn't up until now. And I had some other issues relative to kidney stones, which I needed to have taken care of locally. So I ended up with a kidney specialist at Cape Cod and a dermatologist at Cape Cod. I still was in control of what was going on. I could call my dermatologist, and if they had to if something was going on, they would send files back and forth as far as Beth Israel was concerned. And the same thing with the kidney specialist. I would call, they would go back to the people up at Beth Israel. Beth Israel could talk to one another. I was going up to do a regular checkup, and they required some scans, blood work and so forth it was twice a year, and it came, now I'm down to once a year. But they could talk to one another. However, my kidney specialist moved from Beth Israel over to Mass General. Guess what? It doesn't work. They don't talk to one another. They're not on the same system. Now, they can talk on the phone. If I have a problem, not a problem, if I have a test run at Beth Israel, I can ask the Beth Israel people to forward that information over to Mass General, and that may or may not happen. I also have a primary care physician who's not integrated to anybody in this system whatsoever. Again, I become the primary communicator, if you will, between these specialists. I like to think now I'm in relatively good health. My family may or may not agree that I'm kind of got it together intellectually. I think of some of my friends and some of my other family members who are suffering in terms, not suffering, but have these issues relative to multiple diagnosis and being able to control that communication between this system. I think right now I can do this. 5 years from now, when I turn older, I'm not sure that I'm going to be able to do that on a regular basis and be confident that the care that I'm getting relative to my melanoma problem, my kidney problem. You'll notice I've added another function in here at the bottom of the chart, which is an orthopedist. I've had rotator cuff surgery, and I've had a meniscus tear in my knee, which requires scans because I don't have a kidney. Now I have an issue relative to creatinine level. When I do scans with, I think it's a dye, you know more than I do relative to that, but I know when I have to go to have a particular scan, if I have a certain dye, I know that they need to check for the creatinine level. But do they know? A system that would allow that to be integrated would do wonders for a patient like me who's responsible for making sure that all aspects of my health care are completed based on a complete medical record, which equates to, if you go back to the beginning, what we were initially talked about, and that was a folder this thick, only this time it's not paper, but this time it's digitized, computerized, and easily accessible and easily read, as opposed to trying to thumb through 28 years of military medical records to find out whether they're about what they're ready to do to me is going to be appropriate given what happened to me, say, 28 years ago. Anyway, I thank you very much for the opportunity to talk, to give you a little bit of a patient perspective on what we need, what we as patients need to manage our own health care. Thank you.
Great, thank you, Dennis. That was great. Next, I would like you to welcome Jess Buchanan. Jess is a native Vermonter who was diagnosed with type 1 diabetes in 2007. Since her diagnosis, she has become a healthcare advocate for herself, and she teaches others to do the same. Jess has a history of working in both healthcare and the customer service industry and uses these experiences in managing her own healthcare. Please welcome Jess.
Hi there. This is my first time, so please be patient with me. And I'm going in a little bit of a different direction than Dennis, so I hope you don't mind, but still trying to provide that patient perspective. And thank you again for the invite to be here today. I think that most people can say that they have a day that changed their lives forever, whether it was the day your child was born, the day a parent passed away, the day you met your soulmate. It's amazing how one moment in one day can change the entire course of your life forever. That day for me was April 26, 2007, when I was diagnosed with type 1 diabetes. The diagnosis itself came as a surprise. I have no family history, and the doctor never thought to check for it over months of my visits, complaining something is wrong. Something is wrong. She had me see an infectious disease specialist after several eye infections and ear infections and other strange infections, and they didn't find anything. We found a lump in my side, so we thought maybe a hernia. I have a very strong family history of those. It wasn't a hernia. On that fateful Wednesday, I showed up to her office in tears. At this point, I was drinking a gallon of water a day just at work, which meant frequent bathroom breaks during the day. I was losing weight, even though I was always hungry. I was always eating. Looking back, it's easy to see these as signs of diabetes, but we weren't looking for it, and I didn't know those signs then. So we decided to leave some samples and have them tested for everything. I got a call from the ED that night at 7 o'clock saying, we need you to come down here. Your blood sugars are very high. I was familiar with diabetes as far as a range of where your blood sugar should be, which is between 80 and 120, and my blood sugar was 590. So I said, well, I'll come down. They said they needed to rehydrate me and run some tests, and I headed to the hospital thinking somebody screwed up. My sample got mixed up with somebody else's. There's no way I have diabetes. I was wrong. I had diabetes. So they couldn't tell me in the hospital that night whether or not I had type 1 or type 2, just that I had diabetes. They gave me 2 liters of fluid and sent me on my way with no further instructions other than to see an endocrinologist. So it's pretty life-shattering news to receive without a lot of information. Over the next few days, I began to immerse myself into the world of diabetes. I learned how to give myself an insulin injection. I learned how to count carbs, and I learned how to do a finger stick. As time went on, I learned diabetes has its own dictionary filled with acronyms such as DKA, MDI, and A1C, and there's scarier terms too, like diabetic retinopathy, dead-in-bed syndrome, gastroparesis. I'm a person who likes to learn. I'll read just about anything I can get my hands on. So when my diagnosis came, you can bet I dove headfirst into any information I could get my hands on to teach me how to live my life better with diabetes, to teach me how to eat, how to manage my blood sugars, what my body was going through, because I didn't even have a basic knowledge of what diabetes was or how it affected my body. I learned, however, very quickly that what I needed most to help me care for my diabetes wasn't something I could read in a book. It wasn't something I could learn about from the internet. I had to learn how to advocate for myself, how to be my own best advocate in the face of a healthcare system that I had zero idea how to navigate. It means I take advantage now of every opportunity I have to educate. I truly believe that passing knowledge to others in order to combat apathy and ignorance, it's the strongest tool that I have in my advocacy arsenal. Diabetes is a largely misunderstood disease by the general public. There are those who don't know that there are 2 types, well, more than 2 types of diabetes, but 2 main types. Type 1, where your pancreas no longer produces insulin on its own, and I must rely on external insulin all of the time to keep my blood sugars regulated. I do this with an insulin pump. Type 2, your pancreas does still produce insulin, but it's either not enough insulin or it's used ineffectively by the body. There are those who assume I ate large amounts of sugar as a child. I won't deny that, but I can tell you that science has proven that's not why I have diabetes. And there are those, yes, even in the medical community, who when I was diagnosed at 26 years old said, you're too old for type 1 diabetes, or you're too skinny for type 1 diabetes. Somebody didn't give my pancreas that same memo. I don't blame people for not knowing much about diabetes. I wish I didn't have to, but I do. So I'm always happy to answer people's questions about my devices, which are often visible, about my symptoms and my diagnosis, and most recently, about whether or not I can someday have a healthy pregnancy, which I'm happy to say all of my healthcare providers are 100% behind that idea. Over the last 8 years, I've had my share of diabetes issues and problems. I've been hospitalized twice. I've ridden in the back of an ambulance. They're not moments in my life that I'm proud of, but I learned that diabetes and pride don't really mix very well. Throughout these issues, though, no matter how awful I felt or how much energy I would need to expend, I still had to advocate for myself. In the back of the ambulance, I taught the EMT about my continuous glucose monitor, and I also showed the nurse upon my arrival in the ED. During a brief stay in the ICU, I showed my nurse how my insulin pump worked and explained why, for me, pumping is the best way to manage my diabetes. The face of healthcare itself, in my experience, has changed drastically in just the short time since my diagnosis. Other than the obvious changes, such as most preventative care being covered, referrals to specialists becoming unnecessary, and flu and other vaccines more readily available, I'm finding more healthcare providers recommending holistic healing methods and opening the door to a conversation about mental status or safety at home. I've also noticed how medical facilities are making it easier for me to communicate with my providers and also to access my own medical information. I'm discovering more providers active on social media, whether to take part in conversations and answer questions or simply stay current on the issues that their patients face. In this age of technology that we've found ourselves in, it's so important, albeit somewhat difficult and time-consuming, for providers to take advantage of technology and use it to help their patients get and stay healthier. It has made it easier for me, as a chronic illness sufferer, to get what I need in a timely manner. Whether I need a prescription, a referral, an appointment, or any number of things, I can get on my smartphone or a computer and I can do it. I can do it without having to dial a phone and sit on hold for 10, 20, 30 minutes or more. It allows me the freedom to focus on something other than my diabetes, which already gets so much of my focus. I could list many ways in which healthcare could change that would make my life as a patient easier. There's the cost of prescriptions, which I, of course, wish were lower. We've seen in the news lately just how grossly overpriced these medicines can become when people start thinking about profit and stop thinking about people. Insurance coverage could provide great care at a low cost in terms of premium, deductible, and out-of-pocket expenses, but this is just my wish list. I would also encourage doctors to connect with their patients however possible, not only through the use of social media and email, but also to realize that their patient is always more than their disease. Diabetes is a large part of who I am. It's something that weighs on my mind nearly constantly. Finding a doctor who reminds me to be easy on myself after a few days of bad food choices or forgetting to take a bolus, I need that. And I need that more through email than I do through a bi-yearly appointment. I need to be able to reach out to my provider when I'm feeling like I just can't do this and I need a diabetes vacation, which doesn't exist no matter how much I beg for it. And I can get an immediate response from my doctor who tells me that it's going to be okay, that there's no judging, there's no fallout. And to develop that bond with the doctor has helped me in my own care tremendously. Also, finding a doctor that agrees no one knows my body better than me is a must. I live in it 24/7, and my doctor might see me for 1 hour twice a year. It doesn't mean I don't appreciate the advice or the insight or the information that comes with that bi-yearly doctor's appointment, but it also means that I know best whether the side effects of that medication are worth it for me or what insulin pump is going to integrate best with my lifestyle. But it also means that my doctor can count on me to reach out when I have a medication change that affects my blood sugar and I need some help figuring out how to adjust my pump settings. I'll reach out when I've made changes to my pump settings on my own to let them know, hey, I've seen this pattern where I'm going low every night at 3 a.m., and I've made this change and I just want you to know it. In that vein, there are many ways in which I could become a better patient. I could ask for prescriptions and refills before I run out. I could actually remember to visit the lab in between office visits. I could show up on time to my appointments with a list of topics to cover with my doctor. I already do most of these things, but I remember that if I want to have a great working relationship with my doctor, and if I want them to get me what I need in a timely manner, that I need to pay the same respect back to them. There is one other way in which technology has affected my life with diabetes positively, and that's the diabetes online community. Through social media, mainly Twitter and Facebook, I have connected with literally thousands of other people who have diabetes like me all over the world. They help with questions and concerns about burnout, or what pump do you use, or what insulin do you use, or how does this work? They can understand me in a way that nobody else can, not even my husband or my parents or my sister, who are so active in my care, and they try to understand, but they can't. Unless you live it, you can't understand it. But in the end, I'm learning to be grateful. Grateful to be diagnosed with a chronic illness at a time when technology helps me live a mostly full and normal life. Grateful for a knowledge and understanding of my body that most of my peers don't possess. I'm grateful for a chance to educate and advocate. And I'm grateful for doctors who realize utilizing technology creates patients who are not only more connected, but most likely more willing to take an active role in their healthcare. And what doctor wouldn't want that? Thank you.
Thank you so much, Jess. That was very inspiring. Next, I would like to introduce Jan Oldenburg. She is a senior manager at Ernst & Young's Advisory Health Care Practice. She is the former vice president of physician and patient engagement at Aetna Accountable Care Solutions and was a senior leader at Kaiser Permanente, where she developed and implemented consumer capabilities for both care delivery, and yes, she's really done a lot of stuff. Yes. Jan is the co-chair of the National HIMSS Connected Health Committee, and she frequently speaks and writes about patient and physician engagement. She is the primary editor of the book Engage, Transforming Healthcare Through Digital Patient Engagement. Please welcome Jan.
Can you hear me? Would that be those of you in the back? Can you hear me? Okay, great. I'm going to actually start out by asking how many of you know the story of the walking gallery of healthcare? Oh, come on.
I'm gonna say I saw another.
Katie? Couple? Yeah, we've got a couple. Okay, I'm going to actually start by telling this story. Because the whole area of what we need to do in the healthcare system to be more engaging for patients, and what we as patients need to do to hold up our end of the bargain and be more involved in our care is my passion, in particular at that intersection of how technology can help us do that. So for me, when I finished the Engage book, or a little before, I knew that I wanted the cover painted by a woman named Regina Holliday. Regina Holliday is a patient advocate who writes and speaks now about general issues, but in particular about her husband's experience of dying of kidney cancer. And it wasn't, he may have been terminal in any case, but it was compounded by the fact that she couldn't get access to his disparate health records. And when she asked for his records in order to get a second opinion, the hospital said, yeah, but it'll cost you 75 cents a page, and it'll take us about 6 weeks. His record was thick. So in that time, he died. And Regina is an artist. She, in her grief and her rage, painted the story of Fred's care on the side of a building in Washington, D.C. as a mural. And it was the start of her career as a patient advocate, and much of what she does is transformed into art. About a year into this journey, a woman named Jess McCabe, that some of you may follow on social media, Jens McCabe, sent her a couple of jackets and said, if I tell you my story, would you paint it on the back of my jacket? So when I go to conferences, I can wear it and know, A, that the patient's voice is always in the room, and B, remember why I do this work. So when we asked Regina about the cover of Engage, she said yes, but only if I can paint it as a jacket for the Walking Gallery of Healthcare. So this is my jacket. And come back around so that I can speak. Katie McCurdy also has a Walking Gallery jacket on. I don't know if we've got any others. But mine is jacket number 215 in the Walking Gallery, and it represents the hope that patients and physicians working together, using technology can transform healthcare. And I tell this story because I think it's completely germane to what we're doing here today and what we're talking about. And I come to the work, like many others, in part because it fits my goals and is at the intersection of my skill sets. But I also come to it as a patient. I'm an asthmatic and had the experience of tracking all my data and taking it into emergency rooms with me because I graphed it, I could show my peak flows, I could show when I was on prednisone, because I can't talk when I'm in an asthma episode, only to be confronted with the eye rolls from some of my doctors, you know, sort of saying, oh yeah, we got a head case here. Versus a couple of wonderful docs who said, oh my God, data. I've never had data before to show what we're doing is working or not. I also have a husband who had a widowmaker heart attack when he was 46. We're very lucky that he survived that, and I'm not his caregiver. He is perfectly competent to care for himself, but I live within that context of every day, not only is he taking medications, but we're worrying about the impacts. We're worrying about coordinating his care. We're worrying about whether he's getting the most up-to-date treatment and care. So my story professionally is also intertwined with my story personally. I've written a book told from the perspective of the healthcare system about this, but now I hope, about to send to publication one that's really written from the perspective of patients and caregivers and embodying their stories so that we in healthcare can understand where we're getting it right and where often we are getting it wrong and what we need to do to improve. So let me start by talking a little bit about the context of this. How many of you are in healthcare? Okay, so we know this story. The story is that many people, when you look across the population, are suffering from diseases that are at least in part lifestyle diseases. They're not getting enough exercise. The costs of obesity in the United States are gigantic, as well as the cost of the rest of lifestyle diseases. And we can't fix this through the health system alone. We actually need to engage and work with patients who are going to take action on their own behalf. It's the reason Leonard Kish called patient engagement the blockbuster drug of the 21st century, because it's something that if we were seeing the kind of effects that an engaged patient can have on their health care from any other drug, we would be calling it a blockbuster drug. So part of this is about how do we do this better? What do we need to do to be more engaging and help people take action on their own behalf? So this is a rather full slide, but it contains some of the research that I think of as the case for patient engagement. And I'll take a pause on the word patient engagement for a moment and mention that I am in search of a different term, because I think patient engagement has a bit too much of a whiff of condescension, i.e. something that we do in the healthcare system to people, as opposed to something that is intrinsic to people, that they choose whether or not to engage. They choose how to be healthy. And I want more of that sense that people are partners in their own care and that they need to make choices, and that the choices they make moment by moment are the ones that feel rational to them, and that we discount that at our peril. But it is true that people who are activated around their health, much of this research, by the way, comes from the work of, the person who developed the patient activation measure, the PAM score, out of the University of Washington. Okay, I'll get it to you later. 3 a.m. Yeah. Pardon me?
Judy Hibbard.
Yes, thank you, Judith Hibbard. Wow. So people who are activated around their health, who have high PAM scores, have better clinical outcomes. Disengaged patients and consumers are twice as likely to experience a medical error. Think about that. Think about what that means and what power there is in the hands of patients and their caregivers to get the right care. There's a huge piece of it that poor communication is a key source of disengaged consumers and health errors. So you see the health consequences due to poor communication. And just by the way, people who report poor communication with their providers are, I think, twice as likely to be sued for malpractice. So communication features in 28% of malpractice lawsuits. Engaged consumers function as partners. They can support quality initiatives. They report lab tests that when they're looking at them, and if they have negative consequences, they check on it. Sometimes their doctors don't follow up on it. Giving people access to their lab tests can be life-saving. They also report medical errors. So now that they can see their charts, they can tell us when something is inaccurate and might put them in harm's way because of an inaccuracy in their medical record. They also, it turns out, cost less. Not just because they have fewer adverse health consequences, but they actually make better and more cost-effective choices about their care. So it results in savings from readmissions. They handle chronic illness better. They progress along the path to severe illness more slowly than patients who are not engaged. So in a huge number of ways, having engaged consumers who are activated in relation to their own health, like the two we just heard from, is huge as we try to bring healthcare costs under control and provide better care and better treatment to people. So what about this whole technology thing? How many of you are offering a patient portal in your system? Okay. How many of you use a patient portal? Okay, so first of all, for the rest of you, sign up. Go home, sign up. You live in a state where that's an option. So be a consumer and get to it. Now, I'm going to tell you that patient portals are clearly, in their current state, version 1. We need to get better with patient portals. Right now, if you're lucky, they're giving you your test results. They're allowing you to have secure communication with your providers. You can see your medication list and hopefully order prescription refills online. You can get your after-visit summaries, or if you're hospitalized, your discharge summaries. You get allergies, immunizations, conditions that have been reported. Hopefully can schedule or change your appointments. And if you're really lucky, you also have access to your patient notes, or the notes that your doctors take about you. Open Notes Project reports that over 5 million patients now have access to Open Notes, and there are great consequences of this. People who have access to their notes, along with the rest of their record, are, again, more likely to be engaged and to engage in preventive care behaviors, be up to date on their medications, and be up to date on preventive care. But honestly, too many portals are primarily a static record of facts. We need to get to a place where the information in your medical record is dynamic. We heard this morning about Watson's ability to aggregate data from a number of disparate sources. What if I, as a patient, I'm an asthmatic, as you know, I track my data. What if I could also overlay the pollution levels in the places I've been over the last month when I'm about to go into an episode or in an episode? What if cold weather turns out to be one of my triggers? What if I could overlay the ambient temperature in the locations I'm in over the top of my data and be able to start to predict and analyze what's the next best action for me based on what's going on right now in my body and in the environment I live in? That's the place that we've got to get to. There are apps that are trying to get us there. And you combine apps with wearables and the sensor technology, and we're traveling down that road. But it's still a very confusing picture. There's a study that came out this year that said that there are currently 165,000 mHealth apps available. Okay, if you're a consumer, which one do you choose, or ones? If you're a doctor, which ones do you recommend? I tell the story of when I was in the Bay Area and was starting to commute to downtown. I had a number of options. I could drive the whole way. I could drive 2 miles and take Caltrain into the city and then take a bus or a light rail train to get to my office. I could drive halfway and then take BART directly to my office door. And what I wanted was one app that would tell me when I was about to walk out the door which route was the most efficient for me that day. Guess what? I never found it. I downloaded like 10 different apps. I tried them all. Turned out that 2 of them kind of sort of got me there if I used them in conjunction, but I couldn't find one app that did the gamut of what I needed to track. And I think that's where a lot of us are in trying to use mobile apps. There's something like 50% of that 165,000 only do one thing. Well, okay. One thing might be really good if it's the most important thing. But if you've got even 2 things to do, 2 apps, and your patient portal, and maybe multiple patient portals from different doctors, that's a lot to do. It's not very engaging, and sometimes it feels like it's more trouble than the gain you get. Where we need to get with the design and development and implementation of these capabilities is to a place where the technology fades into the background because it's so good at helping us perform the tasks of daily living, which include managing our health. We're there on a lot of things, but we're not there yet with the technologies that we're using to engage patients and the way we're doing it. Another thing that I think matters here is you think about advertising. People in the advertising world have gotten great, again, as we heard this morning, at doing advertising to me personally based on my demographics and my psychographics, the digital dust I leave as I stroll around the internet, where I shop, what I buy at the grocery store. All of that goes into how they market to me. We're at the infancy of doing that in healthcare. And I'm not talking about the marketing side of it. You know, there's probably work to do there. I'm talking about engaging me around my health. Take that kind of data and know that if you're going to try to engage with me, I'm a swimmer. Talk to me about what I could do in terms of making more time in my life for swimming. I've got 2 grown kids. Talk to me about what I can do in order to be able to see them more and what that value that has for me. I make jewelry. Talk to me about why I need to address the hand problem I've got in order to be able to keep making jewelry. Those are the ways that we're going to actually get to the promise of what healthcare can do in conjunction with individuals and their data. I have spent the last 15 months interviewing a lot of patients and caregivers for a book that is trying to take a patient and caregiver perspective on what people need. And I have heard in that process a number of lessons, and some of them are very similar to the ones that you heard this morning. Key thing, interoperability. Patients may not frame it that way. Caregivers may not frame it that way. But they're very frustrated with not having their data all in one place, with having to schlep their records around or worry that their providers don't have access to the most up-to-date test results, that they're going to spend more money on test results precisely because the data isn't available when and where it needs to be. We need to do better at fixing that and thinking about that influx of patient-generated health data from trackers, from apps, and how we incorporate that and help people to understand what it tells them about both their health and their next best action. data needs to be ubiquitous in the technology that promotes it. So we're just at the beginning stages of action in the Internet of Things, where our houses can interact with us to not only keep us healthy, but to add convenience to our lives. So that moment when my refrigerator is actually talking to me about what I stocked it with this week versus last week, and whether it's healthy or not, when my refrigerator is suggesting that I make something with the red peppers that are about to go bad in my vegetable bin rather than throw it out, when I'm getting integrated calorie counts. I seem to be focused on my refrigerator for some reason. But you know, when it can tell what I've taken out of my cupboards and what I'm making it with, as well as thinking about if I'm homesick, if I'm sent home from the hospital, what can we do with sensors in the home to make it feel safer for patients and their caregivers? I can tell you, when my husband came home after 7 days in the ICU, and they sent him home because they didn't think he was stable enough for open heart surgery yet. You know, guess who didn't sleep because she was making sure he was continuing to breathe, and he found it really annoying, let me add. But I would have paid for sensors and monitoring that allowed me to take a deep breath and say, okay, he's not going to die in his sleep tonight because I'm going to be alerted. You know, when are we going to get to those places where we're starting to use those capabilities in a continuous loop to affect people's lives, health, and their stress levels? I've already talked about the fact that, for the most part, we're not that engaging in the way we interact with patients. So, as we heard this morning, more gamification, adding in the social dimension of health, adding in social media. We know that people are about as fat as their fattest friends. They exercise about as much as their fattest friends. How can we, and actually the converse is true as well in terms of healthiness. How can we use that power and help people help themselves in their social networks? And then personalized. And I think this is where it all comes to fruition, is the moment really when you can assess what my activation level is, what the status of my health is, what permissions I've given for you to interfere with my life. When I started turning off my alerts and notifications and trackers, and think through what's the best way of re-engaging Jan in her own health. What are the things that when she's doing better, she's doing that we're not seeing right now, and how can we re-energize that? How can we support her in the behaviors she wants? If you look at the stats every year after New Year's about what people make New Year's resolutions about, how many of them are about their health, exercising more, going on a diet, cutting down their drinking? There's a litany of things that people make resolutions for. They really want to be healthier. And that's the thing that, for all of us, should be motivating. People want to do better. And oftentimes, they either don't know how or they're defeated by their daily lives. How do we use technology to get that right? There's an app, which of course I can't remember, but that allows you to take pictures of your food and then have other people rate the healthiness of what you're eating. And they did an infographic of what those ratings were across the world, across days. So guess what? Everybody starts out in the morning, or most people start in the morning, really green in their food choices. And by 10 o'clock at night, the whole world's a sea of red. People try, and they lose their confidence and their ability somewhere during the day. And every day, what if we could intervene at those moments, support them, and help them to make a different choice in the next moment that they might have otherwise? And I'm going to close on just making a mention of transparency around costs, prices, cost estimation. People are needing to take more of a role in their own, paying for their own healthcare costs. And it is devilishly difficult to do that. One of the stories I've just written about is about somebody trying to be a concerned consumer because he had a $6,500 deductible and he needed an ultrasound. In order to get a competitive price and to actually get the place he negotiated that price with to hold to it, it took 15 phone calls. That's that. Plus several emails to his doctor, plus trying to check his health insurance cost estimation site, didn't cover that procedure, and trying to look at about 5 more sites for comparative cost data. Now, how many of us have that time? If you're a single working mother with 3 kids and you're just trying to stay on top of your life, you're not going to negotiate that path to try to figure out the cost of the next visit, no matter what it's for. We have to figure out ways of making that simpler, the kind of a transaction that you can do from a cost and quality comparison when you shop for a car, or anything else that's a big ticket item. Because your health, guess what, is a big ticket item. So thank you. I tweet at Jan Oldenburg and would love to engage in conversations both here and outside of here. And I think we're going to do Q&A.
Thank you, Jan. Those were some fabulous statistics that you brought forward. Do we have any questions? Anybody like to come up to the microphone, or we can bring one to you?
Oh, come on.
Oh.
Surely we were more engaging than that.
Are we so engaging that you don't have any questions?
Hi, I'm Merle Bushkin. My company is Health Records Corporation. Jan, I heard you at HIMSS. The 800-pound gorilla in all these discussions is what we're talking. The 800-pound gorilla in all these discussions here and at HIMSS and every one of these conferences and all the blogs and so on is interoperability. We've spent $30 billion and we don't have it. Well, if we take a different approach, we have it. I have on this little drive, it's called a MEDCAZ, M-E-D-K-A-Z, all my medical records for the last 30 plus years. That's password controlled, HIPAA compliant, and with 2 or 3 clicks, I or any provider I see can access all my medical records. They're all in one place, and they can search it, they can sort it, they can do all they want. The difficulty in getting something like this introduced has been enormous because of things like meaningful use and other government programs that have sucked the air out of the room. But I would encourage anyone, if you really want to control your records in one place and have them available anytime, anywhere, it's called MEDCAZ. You can go to our website, medcaz.com.
Do you have a question for the panelist?
I think that what they're doing is just say more of it.
Okay.
Because I think the need for it, everybody sweeps it under the carpet. We pass over it and we go on to these wonderful things of Watson and some of the grand public health issues, but the fundamental is the personal health record.
Okay, thank you very much. Is there any other questions or? Yes, sir.
I think I can speak loud. Mine's real quick. You use the word games for engaging the patient. What do you mean by that?
So the question was about, you have a very soft voice, sir. He's asking about the games, the gaming component of patient engagement.
So there is a movement to try to figure out how to help people either both understand and take control of their health by using techniques from the world of game playing. So gamification of healthcare, if you've heard the term. So for example, there's a program I think called BANT that is a game for adolescent diabetics who, so it engages them in competition and social engagement around what their numbers are, their glucose numbers. And so it both builds community among them and it helps the individuals actually take action about their health and have a motivation around it. There are other, there's an attempt to help people manage their mood using an app called Mind Bloom that looks at helping people understand their mood, nurture, do the things that help them, and it's by way of nurturing a plant and getting it. Now, I'm gonna just make a comment that says, I think there's huge promise in the potential of gamification, but not everybody's gonna get engaged by games, so it's another one of those places where you have to be able to gauge your audience. And healthcare doesn't have anything that's engaging as Angry Birds. You know, we just don't. So part of what's going on is we're still, I think, really earnest in healthcare about how we approach these topics. And, you know, in order to really be engaging, we may have to sort of drop some of our earnestness, be a little bit politically incorrect, to think about what really gets people motivated and engaged in a game of another kind, and how we can use those styles to either teach healthcare issues or help people manage their health better. Does that help?
Yes.
Yeah, I've also heard of a game with, it has a lot to do with educating children on being newly diagnosed with asthma, where it has them actually like blowing into a phone during a game to try to get a level to move, and it helps with their breathing treatments and whatnot. So it's exactly as Jan was talking about with the patient engagement, is that's going to work for a segment of the population, that you're meeting them where they're at and where their interests are, and that may be motivating for some but not for others. But it's a really fascinating field of
I'll
incorporating
add
it.
a note that, you know, lots of health insurance companies are trying to get you involved in, for example, group exercises. So you get on a team and your team is competing against others and in order to do exercise. And I have to confess that I work in this field, I should find this engaging, and I find it coercive. So I tend not to participate in those. And I'm like, you know, I have a fair amount of personal shame about this, honestly, because I feel like I should be a champion for it. But for me, that's not engaging. So we need to, again, really be thinking about the spectrum of ways that people get engaged and the things that they do in order to meet all aspects of our audience.
I had a question as a non-social media user expert by any means. I was curious about when you approach a new social media or patient support internet website, number one, is there a certification as far as privacy, reputability, quality that we should be suggesting to our patients that they look for? Or setting that aside, how do you decide that you might be sharing some of your, you know, personal information on sites that are that you have a good feeling that it's reputable?
I'll start, and then you guys can talk about how you make these judgments. So there have been a number of organizations that have attempted to do this. I think URAC is perhaps one of them. And others also who have tried to curate mobile apps, for example, around some of the privacy issues. But there's not a comprehensive way. I tend to look for things like, are they ad supported? Because I tend to be more suspicious of the data that I get from ad supported sites than not. I do look at you know, who's writing them, what the reputation of the organization is, what that means in terms of my assessment of credibility. But it would be great if there were better tools to help people make those judgments. You know, one of the risks of even peer-to-peer support sites is that sometimes they're marvelous and they've got self-policing around the quality of the information that they're disseminating. Sometimes not so much. So as I talked to patients for this next book, I heard a lot of people talking about, some people were very involved in social media sites around their health. Some people said, I found the conversation too negative. It's important to me to be positive around my health, and I needed to go to a more personal support system in order to get that. But I'm curious about you guys and what you use.
For me, there's a couple different things. If we're talking about me interacting on social media with healthcare professionals, usually the sites I would use to do that is Twitter. That's my number one. And the first thing I do is I go and look at their Twitter feed. If it's all links to stories and it's no personal, as a patient, I'm giving out a lot of information about who I am and my disease. And if my doctor wants to connect with me on social media, I need it to not be like just tweeting link after link after link. Say, oh, I found this interesting because, and then tweet a link and it's fine. If you're just sending me links, I'm not going to follow you. Again, the ad-supported thing that Jan mentioned is really important. And then back to the patient, the groups that I belong to as a diabetic that I'm finding on Facebook, I do leave some of them. The conversations are negative. I'm finding other people with diabetes who don't have the access to healthcare that I do, and it changes that conversation. And I try to step in, and that's where I say, oh, well, I've had this experience, and well, I can't do that. And it's negative. So I back away from that because I need to stay positive. But I have found plenty of other groups. And through being online, I have a group of 4 ladies right here in Burlington that I meet with once a month. And we don't even really talk about diabetes when we get together, but knowing that we all get it is nice. And I would never have found them without social media, even though they live in my backyard.
We heard earlier this morning about the void, if you will, of information. I'm one of those because I don't share. I don't go on sites for my medical history. To be honest with you, I've never gone in and looked for or engaged in the social media program. Now, having said that, it's not because I'm an old guy who is not technologically advanced. If you want to ask me about my Ford Explorer problems, I'm all over the internet relative to my automobile. But but as far as going into either social media or anywhere else, I'm one of those missing links, if you will. I don't engage in that at all. So.
Did you just call yourself the missing link?
Bingo.
We did not.
We probably, Katie, yes. One more question.
Yeah, I guess I was curious, so I think something that can be really engaging is using technology for doctors and patients to kind of keep this relationship going outside of the clinical encounter. We know that doctors' time is so limited, so and Jan and everyone, have you thought about kind of the opportunity for a new healthcare provider, a new type of provider who might help kind of continue this conversation and this engagement outside of the clinic?
Did everybody hear that? And about a new type of healthcare provider that would continue the conversation with patients outside the clinical setting. Did I summarize that right?
And I think we're seeing some of that starting as healthcare systems move from a focus on fee-for-service to a focus on fee-for-value, and looking at what needs to happen to keep populations and individuals healthy, because nobody really wants to be treated like a population. But the focal point there is, I think, there's an opportunity for that kind of, I don't know what level it needs to be, but somebody who functions partly as coach and partly as navigator through the system, to really help not only answer the questions, but be engaging and encouraging along the way. And there's interestingly some data that, we've tried that with health coaches and with the care management programs. Oddly, there's some evidence that people actually engage better with avatars than with health coaches, and I'm completely convinced it's because health coaches have a hard time keeping judgment out of their voices. So thinking about ways that we can do that, but do it better and support it as well with technology, I think there's real meat there.
Right.
I was gonna say, I just get most of that from my peers online is where I'm bridging that gap, so. It's worried about that.
End of session.
Yeah. All right, well, thank you so much for attending this session.